be the center of attention. Let's change that.
I'm Jeff Edmonds, and this is my informative speech. According to the CDC, there are 29.1 million people that are affected with diabetes. Of this 29.1 million, 90% have type 2 diabetes. Type 1 diabetes is when your body produces no insulin, while type 2 diabetes is when the body doesn't use the insulin properly. The main causes of type 2 diabetes are going to be discussed, along with the possible treatments, side effects, and possible complications that can occur. So we're going to first talk about the causes. The cause of type 2 diabetes is due to insulin resistance. Insulin is released from the pancreas, and when it has resistance, it doesn't work as properly and doesn't attach to as many cells and let the glucose get from the sugar into the cells to use for energy. The main cause of this is obesity and due to lack of physical activity. There are also other predispositions that can cause your chances of getting type 2 diabetes. According to the American Diabetes Association, African Americans, Latinos, Native Americans, and older people are more prevalent and have a higher chance of getting type 2 diabetes than other people. So now we know about some of the causes. We're going to talk about some of the signs and symptoms. The major signs and symptoms include excessive thirst, hunger, dry mouth, frequent urination, and unexplained weight loss. Some other side effects are fatigue, blurred vision, headaches, and slow healing of wounds. So if you're noticing someone having these signs or symptoms, it's important to get tested. There are two main tests to determine if you have type 2 diabetes, and that's an A1C test, which is a test over the average blood sugar over 3 months, and a urine test where they test for ketones. If ketones are present, this is a direct relationship with high glucose levels. So now, if you happen to get type 2 diabetes for either your predisposition or lack of taking care of yourself and exercises, there are possible treatment options. The first treatment option they're going to try is just to have you eat better and have do more exercise. Sometimes this isn't enough though. I went to the pharmacy the other day and talked to the main pharmacist, and he said there are many different types of medicines that can help with type 2 diabetes. I'm just going to cover a couple quick ones today, and but like I said, there are many different types of medicines. The first one is metformin, and the way it works is it decreases the amount of glucose that's released from the liver. So if the liver doesn't produce as much glucose, then you have less circulating in the blood. The next one is called glipizide. Glipizide actually increases the amount of insulin that is released from the pancreas. Because type 2 diabetes is caused by an insulin resistance, if you produce more insulin, the likelihood of it working properly is higher. And the last one is lactose, which affects your actual cells and their ability to obtain that insulin. So now you might be wondering, how exactly do you test your blood sugar? So right here I have a glucose monitoring kit, and each kit usually comes with 3 parts. It comes with the glucose meter, the test strips, and the actual poker. What you're going to do is you poke your finger, get some blood, and then the test strip reads the reading. An average reading is 80 to 120, and anything above 150 is considered high blood sugar. So I'm going to pass this around and let everyone look at it. So if you don't treat it properly, many complications can arise. I talked and called one of my good friends and family friends named Dr. Dolan, who is an endocrinologist. He studied at the University of California in Berkeley, and he says that their high blood sugars can affect a lot of different parts of the body, mainly the eyes, the heart, and the immune system. The effect on the eyes is that it increases the amount of reactive oxygen species, which can lead to glaucoma and cataracts, as well as blindness. There's also a very strong correlation between heart disease and type 2 diabetes. As I've said, type 2 diabetes is caused by obesity and lack of exercise, so type 2 diabetics usually have high buildup of fats in the arteries, which can lead to heart attack and stroke. And the last one is the suppressed immune system. This is actually a very complex way of how it works, but pretty much the glucose in the blood is used by the pathogen to continue the infection, and your body can't overcome this. If the infection is reoccurring and lasts too long, it can actually lead to an amputation, and that usually occurs in the toes and the feet. So as you can see, 29.1 million people are affected, so this is a pretty serious and relevant disease. I'm hoping that knowing that the causes can help reduce the amount of people that get this type of disease. Understanding the signs and symptoms will lead to quicker and faster diagnosis, which will lead to faster treatment. Proper treatment will reduce complications and hopefully will allow the patient to live a more healthy lifestyle. So get off the couch, eat better, and get some exercise so you're not another one of these statistics. Thanks.